I'm Jordan Lormore. I'm a student physical therapist assistant from Jeff State, and today I'm going to be presenting to you a case about a male patient who presented with a diagnosis of right shoulder instability and a possible impingement. Subjectively, the patient complained of sudden anterior shoulder pain with motions such as dressing and reaching overhead, and an occasional dull clicking and popping sensation. The mechanism of injury was a fall on an abducted and externally rotated arm 2 weeks ago while water skiing. The patient reports no prior injury and intends to return to a functional level of overhead stroke while swimming. Objectively, the patient presented with bilateral protracted scapula and a overall decreased right shoulder strength and range of motion with an altered scapulohumeral rhythm. At the patient's 4-week reevaluation, he reports that there's a decrease in the frequency, duration, and intensity of the sudden anterior shoulder pain, as well as a decreased frequency of the clicking and popping sensation. Objectively, the patient he shows an overall improved scapulohumeral rhythm, but he also presents with scapular winging with right shoulder abduction. The patient has now achieved full active range of motion, but he still has a positive NIRS test on the right shoulder. The patient is anxious to get back in the pool soon, and his new 4-week goals are a negative NIRS finding, full active pain-free range of motion, and being able to swim 500 meters without increased symptoms. The patient's treatment plan is going to focus on stretching the inferior capsule and strengthening the shoulder muscles as well as the shoulder's proprioception. By improving the strength and proprioception of the shoulder and improving the motion of the shoulder by increasing the inferior capsule, we can move more forward toward a more normal scapulohumeral rhythm and decrease the signs of impingement even further. Okay, for this part of the treatment plan, I'm going to be showing you a joint mobilization. This is Trina Thompson. She's going to be my patient, and we're doing the shoulder instability again. And for this joint mobilization, we're going to be doing an inferior glide, which is going to create more extensibility in the inferior capsule and allow the humerus to slide more inferiorly as it rolls superiorly, decreasing impingement. So we're going to have the patient lie down on the table and scoot to the edge of the table. We'll abduct the right arm to 90 degrees, securing underneath the elbow. You're going to give the arm just a little bit of outward force to distract it out of the glenoid cavity. Palpating the acromion, and then I'm going to come just distal to it with my the heel of my hand on the most proximal part of the humerus, just distal to the acromion. Then I'm going to give an inferior force with my left while distracting with my right and giving a superior force. And then I'm just going to mob into a grade 4 at the very end of the capsule extensibility and just mob there. And then I'm relaxing. I'm letting off for a minute to give her a break. And then returning to a grade 4 mob. Okay, so this is one of the home exercises that I'm going to have my patient do. I'm calling this the ball wall clock, and it's to increase shoulder strength and proprioception. And what I'm going to have my patient do is take a larger ball, like this Swiss ball here, and place it directly on the wall, and then a smaller tennis ball directly over the center of the large ball. And then The patient needs to be standing with their arm parallel to the floor and their elbow extended. Their hand needs to be in line with their shoulder, and then not to shrug the shoulder while they're doing this. I also have a wide base stance, which is keeping me from getting any lower back pain here. And then for this exercise, we're just going to take the ball up to 12 o'clock and then down to 6 o'clock and then back to the center. And then we can go to 3 o'clock and 9 o'clock and back to the center, to 1 o'clock and 7 o'clock and back to the center, and so on and so forth. When we're moving from time to time on this imaginary clock, we want to think about not going so far that the ball is going to move out of position, where it's just a small movement in each direction, back to the center every time. The patient will do this for 2 sets of 3 minutes each, 2 times a day. So they'll do it for 3 minutes, take a break, do it for 3 minutes in the morning, and then at night they'll do another 2 sets of 3 minutes each. The objective data for this exercise is a positive NIRS finding. For this patient, I would educate them on not shrugging their shoulders with overhead activities when reaching up or taking their shirt off, but to really try and focus on what we had been working on with our NMES, our functional stem, of letting the scapula go as we move our arm. Upon reevaluation, the patient showed decreased frequency and intensity of pain, as well as an improved range of motion and scapulohumeral rhythm. The patient lives an active lifestyle and is very motivated, and should return to a functional level of overhead stroke while swimming by his next 4-week evaluation.